Oh, hello everybody, this is Chris back with the Ancient Scholar. I'm just doing a follow-up video to video number 3 on basic or introduction to mechanical ventilation. After reviewing that, I just wanted to emphasize a couple points and to make sure there wasn't any confusion, because I was giving two sets of values on the parameters for initiating mechanical ventilation. I just want to go over those real quick, just so there's no confusion. First, I talked about the NIF, or the MIP, the negative inspiratory force, or the maximum inspiratory pressure. Now, the normal is negative 50 to a negative 100 centimeters of water. That's on a normal person. When it gets under negative 20, that is an indication for intubation. But again, normal is negative 50 to 100, negative 20 and under, negative 18, 17, and so forth, so on and so forth, is an indication for mechanical ventilation. That's a person that doesn't have good negative inspiratory force, and they're probably not going to be able to pull good tidal volume and ultimately good minute ventilation. The second one was a vital capacity. The normal vital capacity is 15 milliliters per kilogram. Actually, much higher than that. Probably somewhere in the neighborhood of 65 to 75 milliliters per kilogram. But anything less than 15 milliliters per kilogram or less than a liter in an adult patient is a consideration for intubation. Tidal volume, the normal adult tidal volume is 5 to 8 milliliters per kilogram. That's a spontaneously breathing adult in no respiratory distress or no one with increased physiological load. Now, when that becomes less than 5 milliliters per kilogram, that is an indication for mechanical ventilation. The normal respiratory rate is about 12 to 20, again, in a spontaneously breathing adult patient. When that respiratory rate goes above about 35, we have to be concerned about increased work of breathing, small tidal volumes, respiratory fatigue, respiratory insufficiency, and impending respiratory failure. So greater than 35 is considered an indication for intubation. The pH of less than 7.25 is considered an indication for intubation. That is pretty low. That's quite acidotic. And generally, that 7.25 is going to be associated with a respiratory acidosis. A metabolic acidosis, there's some wiggle room there because you can run into patients like, for example, somebody with diabetic ketoacidosis who may have a very low pH, but is maintaining the airway and ventilating quite well. Obviously, people in DKA can certainly become fatigued because they are having to ventilate to compensate for that metabolic acidosis. What I'm talking about here is 7.25 or under with some sort of respiratory component. The CO2 of greater than 55 and increasing despite interventions is considered an indication for intubation. The PF ratio, that's a ratio between the PaO2, the FiO2, PaO2 on top, FiO2 in decimal form on the bottom. So let's say your PaO2 is 100 and your FiO2 is 0.3. That 0.3 would then be divided into the 100. Now, if that ratio is less than 200, that is considered an indication for intubation. That's pretty abysmal. That indicates that your patient's on a very high FiO2 and you're getting very little in the way in terms of your PaO2 back. So there's some sort of a problem that is preventing the diffusion of oxygen across the alveolar capillary membrane. It's some sort of shunt, more than likely. Now, a normal PF ratio is actually greater than 300, and some sources will even say up to 475 is considered normal. So when you get down to about 200 or less, this is certainly a very serious problem. And then the PaO2 less than 70 in spite of interventions. And then there's some wiggle room on the CO2 and the O2 because there are chronically hypercapnic and chronically hypoxemic patients. So we have to marry those values with the clinical presentation. And in fact, none of these values should be looked at in a vacuum. All of these values should be looked at in response to the overall clinical condition of the patient, the overall assessment of the patient. And if the patient is clinically not doing well and you have this additional evidence to back it up, that creates a good case for intubation. So don't take these in a vacuum by themselves. Okay guys, hopefully that cleared up any confusion over the certain different values that we can assess as indications for intubation. Thank you and take care.